Local hospitals are bracing for a Labor Day rush.
WDRB's Stefan Johnson explains the potential problem causing concern for healthcare workers. Stefan.
Well, good afternoon, guys. With COVID cases on the rise and so many people on the move this holiday weekend, emergency departments at U of L and hospitals across the city are preparing for a very busy weekend.
It's just very busy. You know, you're walking into usually hallway beds from early in the day.
Dr. Martin Hacker is with U of L Hospital and says the rush started before the holiday weekend.
I know about our main three locations that I work at, which is here at U of L and then at U of L South and then Jewish downtown U of L. And so we're seeing increased census basically at all places.
Dr. Hacker says despite the vaccine, the pandemic is still packing local hospitals.
We have a lot of people with COVID symptoms right now. We're running a whole lot of COVID tests. We're having a lot of positives. We have a fair amount in-house, up near the most we have had COVID positives in our system.
And U of L is not the only hospital trying to navigate limited bed space in crowded emergency departments. Both Baptist Healthcare and Norton's hospitals are just as busy.
Most days we're full or over full on capacity, and our ER is as busy as ever.
Kristen Pickerel is with Norton Hospital and says like other local healthcare systems, COVID is the cause for a lot of the ER visits.
And what we're seeing is an influx of people coming in just wanting COVID testing or experiencing very mild symptoms that really don't warrant emergency type care.
Meanwhile, now that the holiday is here,
it's going to be very busy.
Healthcare workers say they'll be there for anyone who is sick or injured. But there's also one more thing they want you to know.
If you're severely injured in a car wreck, you're going straight into our trauma room with immediate care. But if you have something that's triaged at a lower level, you could be waiting hours to be seen.
That's really emergency medicine. We have to triage based on how the patient's doing and their vital signs and their symptoms, and we've got to care for them first.
And right now there are still COVID testing sites throughout the city. And if you're feeling sick and it's not an emergency, health officials recommend going to an immediate care center or calling your family doctor. Live in Louisville, I'm Stefan Johnson, WDRB News.